It's a great pleasure to welcome Dr. Ashraf Mungid, and he is a consultant endoscopist living in Ireland, but a dual citizen from Egypt originally.
Yeah.
Good to have you with us, Dr. Mungid.
Thank you.
When do you recommend endoscopy?
So usually recommend the endoscopy for everyone who has any symptoms, persisting symptoms,
Such as
persisting dyspepsia, abdominal pain, or persistent reflux, not responding to the regular medication for 2 months, or other symptoms from the colon, like bleeding from the back passage.
But there are several different kinds of endoscopy, like
Of course. So
there's the upper and there's the colon.
yes. So usually if someone come with bleeding from the back passage or constipation, abdominal pain, or chronic diarrhea, we offering them to have some initial investigations.
Through the mouth?
No, usually it's some blood investigation and stool analysis, and depending on the results, we can proceed for either full colonoscopy or short sigmoidoscopy, short segment for the examination to the colon.
So to examine the colon, you still do it from the upper?
No, from the back passage.
From the rectum?
Yes. However, if you're developing symptoms from the bad reflux, abdominal pain, then we can go for the gastroscopy.
Okay, and you were saying that this procedure is used for diagnosis only, but not for treatment.
Of course, it is for the diagnosis, but some procedures we can do is still existing, especially people with bleeding from the mouth. If they have vomiting blood, we can find small ulcers or bleeding points, then we can treat and intervene. Or if they have bleeding from the dilated vessels, we can still do this treatment for that bleeding vessels.
Using this tube, the endoscope?
Yes, using the endoscope.
I think you have a fly on your collar there. There's a fly?
Yeah.
Okay.
Yeah.
So you were saying that this is a simple procedure, but critics would argue that this is a high-risk procedure, in fact, because complications do occur, and quite often.
Yes, so it is very important for the public awareness to know that there is no procedures is totally safe 100%. There is some risk, especially with elderly people with complicated.
But why would I do it knowing that I could end up bleeding, I could end up with, damaging my gastrointestinal tract?
Yeah, so the reason
it has happened,
for that,
right?
Yes, that is recorded in the all over the hospitals, all over the world. So there is quite
and people
good
still
number.
Do it.
Yes, because if you should make a balance between the risk and the benefits you are taking from the endoscope. There is minimum risk, but that could be happening in the form of some bleeding, some penetration to the bowel that could be happening.
But you were just telling me before we recorded this interview that some patients have had to have surgery as a result of this endoscopic procedure.
And yes, and actually before doing the procedure, we explain to the patient if that complication happen, it might turn up to a surgery.
Tell us about that case you were telling me about. So why did they have to have surgery later on?
Yeah, so that particular gentleman, he was 70 years old and he is very frail. And during the procedure, he got
But you knew that beforehand. You knew he was frail, you knew he was old, and you still went ahead.
Yes, because he had some specific cancer to the wall of the stomach, and we need to remove that cancer. So we had the choice, either to take him to surgery straight away or make a trial to remove it with scope only. He accepted to take the challenge. Then we removed it through the scope. Unfortunately, he gets some perforation to the stomach wall, and he needed a minor surgery rather than the previous one. There should be a big surgery.
Well, tell me about the new advances. What are the new techniques in this field?
So we have now a new technique, like it's a small capsule endoscopy called. It looks a small camera. So a man, he is swallowing that camera, and it stay in for 24 hours. and then he passes it. And through the Wi-Fi, we can still record what's seen. But unfortunately, until now, we don't have any therapeutic procedures done by that small capsule.
Oh, so they have a new capsule instead of that big tube that goes down.
Yeah,
it's not really a big tube, but it's still a tube down your throat.
Yeah, but that capsule as well, it had some complication, could be happening in the form of can be stuck
That
inside.
too?
Yep.
More complications? I don't want to do it, ever. I hope not.
Yes, but
But
the point is that we saved lots of patients from cancer and from dying by early diagnosis of the
it's Colon
cancers.
Cancer Awareness Month. What is your message? What are you involved in any campaigns?
Yes.
Raising awareness?
Yes, so my message that for everyone above the age of 70, he should go and do stool test, that very simple test, and it comes positive if there is blood there, then we should offer for him colonoscopy.
Thank you very much, Dr. Ashraf Mungid. That's all we have time for, but thank you for joining us on the program this week.
You're welcome.